Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Donald Trump campaigned on saving vaping, but under his watch, the FDA has seized more products than any previous administration and doubled down on the very anti-nicotine crusade he once promised to stop. In our 10 years covering the U.S. vaping industry, never has the future looked so bleak. Joining us today to unpack the mounting contradictions of Trump's FDA is Lindsey Stroud, THR policy expert and founder of Tobacco Harm Reduction 101 at thr101.org. Lindsey, it's great to see you again.
It's always great seeing you. It's like my debut for THR 101 on the show, so thank you so much for the opportunity. I really appreciate it.
No problem, and thank you for joining me with all the creaks and leaks and stuff like that with the technology. This is our first live show back, so hopefully it turns out okay. So first of all, let me just ask you about this. Youth vaping rates in the U.S. are at their lowest levels in 10 years. How is it that Trump's FDA is still hyping the so-called youth vaping crisis?
Oh, short answer or long answer? I mean, the short answer would be that it's sexy to talk about. I guess the best way to, youth vaping. They're almost harping the stuff that we were hearing in 2019, if you read some of the language, but they're ignoring the data. Actually, I was at McCurry. It was either McCurry or it could have been Kennedy, but one of them said that they believed that the NYTS numbers, the National Youth Tobacco Survey numbers, were inflated, or no, not inflated, that they weren't high enough or something. And it's like, well, they're actually inflated numbers. The youth vaping, technically, daily vaping is even lower than what we know. 2024, it was 5.9% of U.S. middle and high school students were current e-cigarette users. That is like a 76.5% decrease from 2019, when 20% of them were vaping. It seems just that that's the easiest way for them to go after these. You have a massive influx of vaping devices that don't have authorizations, because the FDA has only authorized 39 products. And back under the Biden administration, you remember when 2021, when they started issuing the massive denial orders, and now there's been millions, hundreds of millions of products that have been denied. But obviously there was consumer demand, so FDA hasn't been able to really keep up with legal consumer demand. So, but it's justification for going after these companies that are selling these unauthorized products, unfortunately, and it's going to harm adult consumers, because we do have what is it, 1 point some odd million kids that are vaping, like 1.9 million compared to 20 plus million adults who are vaping. It's clearly we know who are using these products, and it's not all the kids.
Yeah, there's quite a bit of disparity between those two and why they're putting so much focus on the kids when clearly it's not a crisis anymore. But before we spiral into that, take a moment and tell us about thr101.org. When did it launch and what's your mandate?
Oh, yeah. Well, thr101.org was pretty much started as a glorified blog in 2020, and taking on some of the research that I'd done at previous organizations, including the Heartland Institute at that time. And then so this year, I decided to revamp it and start putting more of my data on there. And then I also turned it into a 501c3 nonprofit based out of, it's registered out of the state of Florida. Got a board member consisting of some really awesome people, including Nick Orlando from Florida, Danny Gillis out of Tennessee, Lisa Chaloni from Rhode Island. They're all vape shop owners and or presidents of their respective state association. And then we also have a state representative from New Hampshire, Representative James Spillane, that is on the board. We are waiting for our 1023 status, and with the government shutdown, it's probably going to take a little bit longer. But that's where the 50 states are housed at. So we've got the updated this year's numbers, and they look really cool. There's moving graphs and everything, and there's just more up-to-date content, and everything that I do on it gets kind of like published there. So it's a really good, resource. And I actually built it all by myself, and I'm not a web developer, so I'm actually really impressed with how it turned out. So
Well, there you go. So
not perfect, but it works.
yeah, well, and that's all that counts in a lot of cases, no doubt. So let's take a quick look at this. This is a statement from FDA Commissioner Marty Makary, who just this week, so this is like 3 days ago, they're encouraging retailers to stop selling illegal vapes. And, critically, the very first sentence here just drives me crazy. As part of the FDA's broader strategy to combat the crisis of youth vaping. I mean, that's a bald-faced lie.
Yeah. Yeah. Well, at least it's not epidemic, okay? I mean, because you had what 2 years ago, Brian King had, at Center for Tobacco Products that then at the Center for Products at FDA had sat there and said that the FDA had quit using the term epidemic because the data didn't signify that it was an epidemic. But I don't think there is a crisis of youth vaping at all. Again, youth vaping is at an all-time low. At the same time, you have probably the most amount of e-cigarette products on the market, legal or not. And while you haven't seen an uptick, you would expect with this influx of, these disposable vapes that kind of came out in the market after FDA had denied all of these applications, you would have expected an uptick. And I remember some of the tobacco companies like were expecting like in 2023 for their rate to be an increase because that's when we started seeing these massive, shipments of these disposable products coming in. And I feel that they were a little bit disappointed when the numbers showed that it was still declining, even though you got all these products on there. So it just shows that these are tobacco harm reduction tools for adults. And I actually know an older woman, she's probably in her 50s. She actually quit smoking years ago using like a mod system, and now she's on disposables because she likes the flavors better. And also there's a thing with the convenience on them. They're in every C-store, which that's kind of undermining vape shops, unfortunately. And it's a really weird, precarious situation in the States right now. And it's been that way ever since, 2016 with the deeming regulations. And then with the whole, public health groups getting involved. A lot of people forget that with the PMTA, like they were originally supposed to be due in 2022, but then public health groups like American Academy of Pediatrics, Campaign for Tobacco-Free Kids sued the FDA. So, and I mean, it's just good. Also, right now, FDA is acting more like tobacco control than acting as a regulator. Again, you can't have 39 products that are only available in tobacco and menthol flavor for there's 20 plus million adults who vape, and we know they're vaping flavors. We have the data. And we have just even with all the shipments that are coming in, and that they're seizing. So it would be nice to sit there and see more focus, on the adults who vape. I think that still it keeps getting lost in all the narratives. So we keep talking about youth, and it's like I'm like out of sight, out of mind on this one. But there is no youth crisis. There's crises. There's a mental health crisis among youth. If we really are focused on children, we could go down that rabbit hole. But yeah. It's not it's just again it's just using what the Campaign for Tobacco-Free Kids groups and the public health groups using. I mean, and they were okay to use that in 2019 when you had this massive increase in youth vaping, but now that it's died down and everything, even they're acknowledging it. If you remember like the vape directory bills, they were talking about, they've even sat there and said that, youth vaping has decreased. So, public health groups that have acknowledged this, and it seems that this FDA is stuck in its craw to go after these Chinese illicit vapes. I mean, even though all vapes pretty much come from China, so do half of our consumer goods in the States,
Sure. Yeah.
Go to Walmart.
No doubt. And I mean, we're talking about products here that almost exactly the same products in Canada or the UK, and they're legal. And it's not even they're really illegal. For the longest time, FDA was using illicit, but they've ratcheted up now the terminology by just outright saying illegal. But they're not really illegal, but for some lack of, approvals and a bit of regulation, these products are perfectly fine.
Yeah. Yes. And we haven't seen a vaping lung injury crisis with all of these products. If they're so harmful, why is the CDC not giving us weekly updates on hospitalizations related to vaping? It doesn't exist on that one. I remember like some of the companies were like trying to sit here and say fentanyl vapes. And like like you could vape fentanyl, okay? You could vape anything, okay? It's not, if you got a will, you got a way, and everything, okay? But I mean, you're not going to find this in like a disposable vape, okay? It's going to be in something that's going to be tweaked and like that, and it's not as common as they make it out to be. But again, it's just using buzzwords: youth vaping epidemic, fentanyl, Chinese illicit vapes, and unfortunately, what is continuing to get lost is this notion of tobacco harm reduction. The fact that it is not the nicotine that is causing the harm related to tobacco smoking. That there are ways that you can get delivery of nicotine, and unfortunately, our FDA does not recognize this. We have to date, there's been only 81 products that have been gone through the pre-market tobacco authorization process. one of them, like 44% are owned by one company, actually. There's only technically 7 different companies that that have these marketing orders, and then like even the modified risk tobacco orders are even like there's even like there's like 20 something of those. So, and then compared to 15,000 products that the FDA has authorized, using the substantial equivalence pathway, all of those which tend to be combusted products. So it's unfortunate because a lot of Americans there's still over 30 million Americans who are smoking in 2023. Many of them are just misinformed. And when you're doing the ramping up this crusade, this is going to deter people from using it, especially these people might be sitting there thinking, oh, I'm, asking. I remember being in like convenience stores when Juul was still around and like, before like they really ramped down on pots. And I remember some guy being like, does that help people quit smoking? And I was like, oh, absolutely. And I was like, but you should probably get yourself to a vape shop, maybe try on that, start that one, but then go to a place that you can get somewhere where you can taper down and just find your flavor or whatnot. And unfortunately, all of those products are illegal.
So, how do we square this issue that when it comes to nicotine vaping, Trump appears to be running a nanny state?
Yes. Yeah, he's not saving flavored vaping. I mean, the only flavors that have been authorized this year were the Zyn pouches, oral nicotine pouches. And this administration is knocking out all of these flavors. I know that with these crackdowns, I know like with the disposable vapes. I mean, they're going really hard from their customs is coming through and they know where the factory's coming through. So they're just seizing these at the border. And so now you're seeing, I mean, other products are coming out, and they're coming out from different places. I don't think that you're going to be able to actually really crack down on illicit Chinese vapes. They don't have the muscle to do that, but something else is just going to pop up. I mean, we have disposable vapes because of Donald Trump, because of the flavored pod ban. I mean, this is how the marketplace responds. So it's almost like it's prohibition still, and so the FDA, his FDA still, I don't think he understands tobacco harm reduction, and he's not a smoker. And I don't think anybody in his, like the FDA at the high levels were smokers. Because maybe Kennedy uses pouches or something, but I mean, yeah. So, I mean, it would be nice if he could understand these adults that are using it, and that how much this is actually harming them. And I know some of the groups are working on some stuff to go meet with the White House and everything, and to kind of convey this. And so it's going to be, hopefully he'll listen this time, but.
Yeah, it's tough though, Lindsey. I mean, we've been hearing that for years. Advocacy groups and of course trade groups and stuff like that. Many people we've had on this show have talked about their discussions with Trump, and I have been mostly convinced that Trump was going to do something that would benefit nicotine vaping, but it is just impossible to consider that's going to happen. You've got Attorney General Pam Bondi and HHS Secretary JFK Jr. They turned up in Chicago for a photo op at a multi-million-dollar seizure of vape products. Was that September 3rd or 8th? So just about a month ago, yeah. And we're talking millions and millions of dollars. And the sound bites that they gave out were outrageous. They were beyond the pale. And and there seemed to be like anger that they had. Well, why would they have this anger? It's really crazy. So
Well, I'd also, there's been a lot of pushback. I mean, a lot of these seizures were at the behest of the large manufacturers who are, I mean, I've always sat here and said it's kind of a catch-22. You have the 39 products that have spent billions of dollars to get FDA authorization. Many of them, that 3 out of 4 of them also sell cigarettes. And so they're losing, I mean, I get it. They're losing cigarette sales to these products. So there's that. But they're also losing out on their legal products, these illegal products. And so I completely understand their frustration. But at the same time, I'm a tobacco harm reduction person, okay? And these products are not going to be able to sustain the 20 plus million vapors in America, especially the majority of them are using flavored products. So I like what a couple of these companies are doing is that now they're introducing their own non-authorized products. So I'm like, you know what? If you can't beat them, join them. That's fine. I mean, I'm not going to, I think it's kind of a little bit hypocritical with some of the actions that they've done. But I mean, that the large manufacturers were kind of pushing on the FDA prior to I mean, I was under Brian King's, leadership that they started ramping up and working with ATF, the, Customs Border Protection and everything to go after these products and started really announcing it. I want to say it was like I want to say it was like late 2023 is when they really started going after these. And now you're seeing the same thing under the current administration, which I mean, again, I get it. I completely get it. But at the same time, you have made the market, it's favoring only certain manufacturers, and that's a lot of people, and I have to always explain to people that it's like, big tobacco did not create vaping in America. It's actually a consumer-driven revolution through, without having federal regulations, was able to actually really do like a lot of innovation in a very short amount of time in helping millions of adults quit smoking, especially the vape shop is, very instrumental in that one. But now, I mean, and even the tobacco companies have problems. I mean, we only have one heated tobacco product, okay? I mean, and they're still even doing a slow, rollout on it. But again, you can't have just one for these, people who smoke. I mean, somebody who smokes Marlboros might need the different, product advice or something that somebody who smokes Virginia Slims or, Newports. And I think too, that's one of the things where the tobacco companies do have like an edge if they could get more authorizations themselves, especially on heated tobacco products, because that's how you can change, your branding. People go from that one to I was like, oh, well, I'm going to go try this, this company's brand because I'm already smoking their cigarettes and, but then also they can't convey, you have to do a modified risk tobacco product order. And if you want to convey that these are safer, even though the PMTA itself sits there and says that it's appropriate for the protection of public health. So, I mean, I've been arguing for years to just dismantle the Tobacco Control Act and give the power back to the states or alcohol, tobacco, and firearms, when it comes to regulation and I guess, overseeing illegal products. But yeah, it seems like innovation dies at the FDA. Okay, I can't, not really proud of that agency. So,
Yeah. Well, and
yeah.
you made a good point earlier, and it's something I think that we should focus on is that FDA is not acting like a regulator. They're acting like tobacco control, and
Yeah.
they're not supposed to be tobacco control.
No, exactly. Yeah. And the only thing that they need to do is make sure that youth vaping doesn't go up. And so distorting the narrative to and also the FDA Center for Tobacco Products is completely funded by user fees. There is no congressional appropriation for it. 85% of those fees are coming from the sales of cigarettes. So you are using the money from people who smoke because the manufacturers aren't paying these user fees. Everything's pushed down to the consumer themselves. You're using the money for the people who smoke to block options to tobacco harm reduction products. It's very hypocritical. And again, it goes back to that catch 22 though. I mean, at the same time, if 85% of your budget's coming from cigarettes, there's a real is there an incentive for you to even authorize these products that are e-cigarettes are not covered under as user fees. They've been trying for years to get that in, but it's like, well, what are you going to do? Get user fees off of only 39 products that are illegal? You're gonna collect user fees off of illegal products?
Let's one sec here. I'm just gonna send us over to my computer here. All right. So let's just take a quick look at this. I mean, this is stark data, in a good way. U.S. adult vapors in 2024, there were 18 million adult vapors. And that is a 2.5 million more than it was in 2023. In 2025, 20.5 million vapors. Now, of course, a lot of them are using disposables. But if we're looking at nearly 21 million American adults are using nicotine vapes. This isn't pouches, this is nicotine vapes. How is it that Trump and the FDA thinks that they could yank those out of the hands of that many millions of Americans?
Well, I actually think those numbers are higher because in 2023, I saw the CDC had 3 million vapors or something like that. But I think there's about 25 million vapors actually, if not more. Yeah, exactly. They can't. I mean, I've been into we've got this tobacco vape shop down the road from my house, and we went in there probably about 2 months ago, and their disposable shelves were kind of empty and everything, but yeah, now they're full again. There's just new products that came out and everything to replace market demand because people will buy it. I mean, people are still buying it. A lot of retailers too. I mean, that's the cost of doing business. I think there's some interesting that Texas case with the civil monetary penalty. So I don't know. I mean, a lot of people probably saw it. It was a win for the vape shop that they had gotten a fine for selling unadulterated, no, an unauthorized product. I did some research on it, and this was a 21 plus vape shop. They were pretty much mixing their own e-liquid, for the customers that were coming in, the of age. These are adult customers. Reading the order, the way that the FDA for them violating interstate commerce clause was the fact that they brought like components from, they ship components from a different state into there. But they had gotten like a warning letter, and then it just went even crazier. They got a warning letter last year, and then it was an immediate like a $20,000 fine. Now, mind you, during the same time period, now, and I couldn't find anything. It looked like the FDA never even did a compliance check in that, bringing in a underage person in to sit there and see if they could purchase this. So, but in the same time period, a convenience store in the same city they got a CMP too, because within like twice within a year they sold menthol cigarettes to a teenager, and their fine was like $700. So it's just ridiculous to see some of the way that the FDA is going after these people. I mean, again, this was definitely not a business that was contributing to the so-called youth vaping crisis at all. But this is the way that the FDA, and again, I know some organizations have talked about like enforcement discretion. It's not a sustainable thing to do, because at any point the administration can change. And then they could start, we're done, you're not going to have, you're going to be on the kind of a gray area where we're going to let you sell unauthorized products. So I just think that there needs to be some major fundamental reforms, because I do think that you're going to have a lot of people actually, I guess we have a storm coming in, sorry.
Yeah, it looked like you had a flicker there.
Yeah, that's still flickering. But yeah, so I mean, you're going to have some major, I think there's going to be a lot of pushback politically, on this, especially, I mean, a lot of people are getting upset, and a lot of people are shutting down their businesses. I mean, the vape shop is pretty much dead in America, unfortunately, because that was really what really helped revolutionize just tobacco harm reduction in general.
And that was the thing back in 2019 when we all descended on Washington, D.C. to appeal to Trump in the,
Yeah.
what is it, We Vape, We Vote. Well,
Yeah.
you got 11,000 vape shops in the country, and those are real people running real small businesses. And it seems that at this point now that they are an afterthought. There's
Yes. Yeah, and they got bamboozled, unfortunately. I mean, and I did a $20 an hour PMTA for these small businesses. Yes, it wasn't robust, like, the Juul PMTA or whatnot, but these people had been in business since like 2013, okay, selling these e-liquids, making these, and then never had any issues with all their customers were adults, okay, they didn't have any issues with youth or whatnot, they didn't have any issues with lung injuries. And then the FDA just completely just swooped it and was like, nope, you have flavors, you don't have enough of the studies done. And also the way that the studies, the PMTA is draconian, it's expensive. And it's really, it's like taking pharma applications and applying it to all these small businesses that, again, they created it. I mean, you didn't see a large tobacco manufacturer actually introduce an e-cigarette in the States until like 2014. When we had e-cigarettes kind of like, introduced in 2007. And there was this massive growth and this massive growth of the vape shop. And then even between, up until about 2019, we were having a lot of innovation, that wasn't completely illegal, but, the pod system came out. I think one company kind of imploded a little bit too big and everything, but it was a great device. I mean, got a lot of people to quit smoking. And there's also became the Kleenex of vaping, so to speak. And then, yeah, so everything kind of got, again, the flavored pod ban led to the disposables come out. And then this, really, the PMTAs being denied really led to disposables coming out. So, but so many people have quit smoking. I mean, you can see it in the cigarette sales and data being down. I can see it in the data that I'm looking at. One of the key features that I've always looked at with the 50 state analysis has always been the young adult smoking rate. I saw that Stan Glantz has something, vaping leads to smoking. No, it doesn't. The 2023 data would be the kids who were in high school during the 2019 vaping epidemic. And it's right now 5.6% of 18 to 24-year-olds across all states are vaping. There's a couple of states where it's like 2%. or not vaping, smoking. There's like where it's like about 2%. And then you have really interesting states too, like Hawaii, this is among all adults. 11% of them were vaping in 2023 compared to 10% that were smoking. So I can't wait to see the 2024 numbers. They're supposed to be coming out on the behavioral risk factor surveillance system survey, because I know you're going to see more of that. And I think you're actually going to see that we actually had a greater percentage of adults vaping in 2024 than the kids that were vaping. I think they're
Yeah,
going to bury that though.
it's a giveaway, the teen smoking, because teen smoking is so low that it's almost barely statistically relevant. So
Yeah.
we had Ken Warner on the show, on our segment for GFN back in January of this year, so 10 months ago, and he's like, he's like, "Where's the parade?" And there is no parade.
Yeah, yeah, exactly. Yeah, and you know, there and also just these falsehoods that that's going to lead to smoking. I mean, yeah, you're young adults smoking, and like 1995, 30% of young adults are smoking. This is amazing. I mean, there's less 18 to 24-year-olds smoking than 65 plus. And that's a public health win. I also think that I mean, I've always wondered what is the vitriol, like what is the hatred from public health groups over something that can eradicate smoking? And then it's like follow the money. There's a lot of money to be made in treating smoking related illnesses. And if you look at some of these numbers that these groups will put out, like how much, how much healthcare, how much smoking costs, like, healthcare, the burden or whatever. And, I was looking at Michigan at one point, kind of like worked out the numbers and it was like, okay, so for every $1 that big tobacco got, healthcare was getting $3, okay, for treating smoking related illnesses. So it's more of I think there's more money. I think it's more lucrative to have people smoking out there than getting them to not have that, because I mean there would be, if you got rid of cigarettes tomorrow, the wings of hospitals would be gone. They're completely funded by treating smoking illnesses.
I think you also should take every tobacco controller out there from every county, every city, every state, and nationally, at every university and every college, everyone who makes money from being in tobacco control, and add all of that up, it would be a lot.
Oh yeah. Oh yeah. I don't even like thinking about it actually, because again, this is the only thing that makes sense right now. And I've been researching on tobacco and vaping since 2016. So it is, and then this push against it is just okay, I get from the anti-tobacco, but yeah, it's really scary now under the Trump administration. And I'm curious what's going to happen at the state level next year.
And that's what I want to ask you about. I'd like you to fill our viewers in, for those that aren't familiar too much with the registry bills. What are they?
Oh, God.
Who's pushing them, and what impact are they having?
Okay, they're a mechanism to use government to knock out your competition. In short summary, the vape directory bills establish a directory. They establish what they just sound like. They establish a directory of legal products that can be sold, or products that can be legally sold in the state. Oftentimes, they are tied to products that have received an PMTA authorization order, and or products that have pending litigation or in a regulatory limbo. I know that earlier last year, this year, when I was looking at that was last year, the first 3 states, it was really weird because they couldn't even tell, like, what Louisiana had like 40 products, Oklahoma had like 1,000, and Alabama had like 300 or something. It's like, okay. And most of their bill language was exactly the same. The people who've been pushing them have been the tobacco companies. Actually, again, as previously noted, I mean they were getting upset that the FDA wasn't really doing any action. So now they put it at the state level. So you have your state, usually AGs. They're the tax person. I think I've seen one state that had the public health agent. One of the public health was actually like enforcing it. Ironically enough, a lot of these bills are actually, I think the majority of the bills, if not all, were sponsored by Republican state lawmakers, which makes no sense why you would use taxpayer funding to do federal enforcement. I argued against them again because I'm not a hypocrite. And I'm not going to argue for anything that's going to limit adult access, and also again lead to more confusion, especially at the state policy level. With these products and trying to establish, these Chinese illicit ones, and just confusing them about the notion of harm reduction. Interestingly enough, like some of these companies that were pushing for these bills are now introducing their own products that don't have FDA authorization. So I'm curious if they're going to go back and tweak some of these languages that now can just be pending applications, not necessarily something that's pending because it's in court or actually has, authorization. I want to say there's at least 15 states, but don't quote me on that, that have passed these bills. It seems like the enforcement is still kind of lax. I mean, I'm in Florida and I guess we have one of these bills, but I can still get disposables at pretty much every convenience station, a convenience store that isn't like a big chain. I guess it's more, yeah, using government to knock out your competition. And unfortunately, it's just harming adult consumers because now you got policymakers who are even more confused about vaping. I swear if I hear popcorn lung in a state hearing next year, I'm going to lose my mind on one of these lawmakers.
No doubt.
Sorry.
No
I'm
doubt.
like, we're like 2026 and we're still, I mean, this thing was debunked 11 years ago. My God.
I know it's crazy. I mean, it's very troubling. And I'm going to bring this back again to Trump because his administration is supposed to be one that clears out this kind of bullshit lies that we've been going through for the last 10 years. And boy, like doubling down on it, it's just a real problem. I mean, it's a real problem. Let's take a look here at this. This was a Goldman Sachs report that came out earlier this year and basically says that by 2025, by the end of this year, it's predicted that safer nicotine products are going to overtake combustible products. Yes. Now, that's sales by volume. It's not necessarily sales by dollars, but still, we're talking about safer nicotine products in the US overtaking combustibles. Yeah. I mean, it's over. It's over. And then to watch the FDA do what they're doing, when millions of Americans are using these products, millions more each year keep joining, even with all of the bullshit misinformation out there, they're still voting with their lungs and joining this thing. It's absolutely, it's unbelievable that we're still having to fight this.
Oh, yes. Yeah, I'm excited for some latest developments that are going to be happening. I know United Vapors Alliance is coming back out, so they're the ones who organized the rally in 2019. So we got a lot of people who are really, really frustrated with this. And I mean, and again, with Donald Trump, I didn't believe in that tweet. Okay, first of all, it was a tweet on Truth Social. And again, it's a tweet. Okay, I mean, I say flavored vaping. I'm going to say it again. I think it was just like somebody met with him, got a photo. He got him to tweet this. And then like we all expected that because of that, that would be credence, our creed, so to speak. And I mean, also it's kind of impossible to do. I mean, there's what are you going to do? Like go through everybody's previous PMTAs and sit there and say that you can do this now? A lot of these places like shut down. And the one thing I can say that my only big qualm about the disposables is the majority of them didn't even file a PMTA. And I'm not like, I have no problem if you filed a PMTA, you get denied and you're still selling it. At least you did, the due diligence to play by the ball. When I did people's PMTAs, and that's the reason I charged $20 an hour. I knew they were all going to get denied, and I felt guilty even taking money. It's like paying somebody for a failing, getting paid to write a failing book report and everything. But I told them, I was just like, if there's ever some reform, you did play by the rules. Okay, yes, you didn't have the big complete all these toxicological studies or whatnot, but you did do what you could do with what you had, and being a proper business. And I know a lot of people whose PMCs, they're still selling, they're still selling their e-liquids and everything. So I tell them too, it's like, hey, just slap CBD on it. Okay. Marijuana, that's great in America, I just start putting your liquid in the liquor bottles, actually, and stuff. I just took a part-time job working at a bar liquor store, and I was just like, oh, mango flavored vodka. Wow. So this is okay, but this Juul is not okay. Oh, that's great.
So
don't like flavors.
Let me ask you about the double standard you've written about when it comes to, say, prescription opioids. So it seems to me that they've not been necessarily so quick to jump on that in enforcement, but here with nicotine, they are.
Yeah, and I know, and what really bothers me with that is that they don't. It's like they're refusing to learn their lesson from the opioid. I mean, they gave us the opioid epidemic. They let these companies market these products as less addictive. They let these pharma reps really aggressively target doctors. We are one of the few countries in the world that allows direct marketing from pharma companies to consumers. Us and New Zealand are the only countries that allow that. So don't even get me started on all the pharma stuff. But the opioid epidemic, once they realized that, like 10 years into it, that they were having a problem, they started pushing the CDC, like started pushing, on pill limits, and actually taking the pills off them, less pills on the market. And so that's when you saw the wave of heroin come in. And then now we're in the fentanyl epidemic. And it's like, you're trying to knock all these products, illegally, and this is what's going to happen. You're going to end up having cartels that are going to come up with, selling vapes on the street, and at that point, you might end up having more kids use them, because now you're just making them a little bit cooler, and a little bit, the bad kids will use them because it's living on the edge. And you're also bypassing all the regulatory stuff that that can ensure that these products are safe. So it's just like, it's just really frustrating to me that they are literally pushing over all these prohibitionist policies that are, and not learning any of the lessons from anything that they've ever done, anytime that they went and tried to, block access. So, I mean, again, I think right now, I mean, reforming the PMTA would be fine. It could be done, but everyone's been saying that for 10 years. I still want to just dismantle the Tobacco Control Act. I don't want FDA to have any authority over it. They can't. I mean, look at what was it, 2023 with the Reagan-Udall Foundation, and that was like, the baby food formula, or the baby formula crisis, and then the vaping epidemic or whatever that they're still going on and everything. And oh well, no, Center for Tobacco Products, like PMTA, regulation and everything. Nothing's changed since then either. There's only been like only a handful of e-cigarettes that have been authorized. And then they got so many other product, pending applications as well. I mean, and even Juul, like at first applied, I think like in 2020, it took 5 years for them to get a marketing order.
I know, it's incredible. So, Lindsey, we're wrapping up here. So let me ask you the burning question, at least in my mind. How do you put any lipstick on this proverbial pig?
I would say, for all the advocates, I mean, keep focusing on the adult vaping, keep focusing on tobacco harm reduction. I mean, and keep harping on it that, there's not, that youth vaping is not a crisis anymore. And that this is stifling innovation. And that, the FDA is now killing American small businesses. I mean, they have been, but now they really are killing them. They've done way so much, they've done so much seizures under this year alone, as you mentioned earlier. So it's just, yeah, just keep harping on being an adult, especially if you're an adult, quit vaping, go on social media, brag, and every single time I always say, and I know everyone who listens to me always gets mad. I go back to Shawshank Redemption and Andy Dufresne, when he wants the money for the library, and he writes them like, a letter a week, and so when like after 6 years, and then they find the state legislature finally comes back with some funding for him, and they're like, please quit sending us letters, and he's like, I'm gonna write them 2 letters now, and that's what you have to do. You have to be persistent, and your administrations are going to change, and new products are going to come out. There's going to always. We already know how to handle the youth vaping stuff. We need to keep harping on it. This is false. There is no youth vaping epidemic. You don't care about, adults. I'm almost half tempted to be like, hey, FDA, how many adults did you kill today? Kind of like, to the mantra of the LBJ one and stuff, because at the end of the day, that's all you're doing is forcing adults. I wouldn't sit here and say back to smoking, but you are limiting the options for all adults. You might be forcing them back to smoking. You might be forcing them into a completely underground market, but all you're doing is limiting, options. And when I live in a country where there's more places to get fast food, fried chicken out a window than there is actually, legal tobacco harm reduction products, we're way behind the rest of the world. And that's not very American.
Well, that is true. Well, thank you very much, Lindsey, for joining us today. And that's it for this edition of RegWatch. Before you head off, please like us on Facebook and don't forget to follow us on X. For RegulatorWatch.com, I'm Brent Stafford.